My question is to the Associate Minister of Health and asks, does he agree that in the year ended 30th of June 2008, in excess of 2,600 children under the age of 5 years were admitted to public hospitals for dental health procedures, and how many of these young children were treated under a general anaesthetic?
The Honourable Peter Dunn.
Yes, but the information provided by district health boards does not contain the numbers treated under general anaesthetic.
The Honourable Jim Anderton.
Speaker, does he believe it is acceptable that thousands of children under 5 years of age are being admitted to hospital each year for dental health procedures, including tooth extraction, under either a general or local anaesthetic? And if not, what steps is the government taking to reduce this unacceptable situation, including an inquiry into the fluoridation of our water supplies as a nationwide health measure?
The Honourable Peter Dunn.
Mr. Speaker, obviously the oral health care of all ages of young people is important, and I would rather that we had numbers presenting to public hospitals for treatment than not presenting in the first place. But I should just tell the member that increasing preschool enrolments is a priority, and in fact in the 2008 year around 43% of all children preschool were enrolled. By the end of the calendar year 2009 this figure was 49%, and by the end of this year it's expected to be 64%.
The Honourable Jim Anderton.
Mr. Speaker, does the Minister believe there is a need for a paradigm shift in the way parents are helped to look after their children's teeth? And if so, would he support the introduction of an improved education program from preschool to primary school?
The Honourable Peter Dunn.
Mr. Speaker, the paradigm shift that the member refers to is actually occurring under current oral health policy, which is seeing the rollout of a whole new network of community oral health facilities, some $116 million in capital funding, $36 million a year in operating funding, and what we're starting to see now is a system being put in place where more children will get access to the care that they need, and we're encouraging their parents and whānau to be part of that treatment program.
The Honourable Jim Anderton.
Mr. Speaker. Can the Minister confirm that whilst pregnant women can access free maternity care during, at birth and post their pregnancy, they cannot access free dental care, and does he support extending free dental care to this key sector of our population?
The Honourable Peter
Mr.
Dunn.
Speaker, I'm not in a position to confirm that particular line of argument, but what I can say is that the range of programs now being rolled out will provide for much greater community involvement in the future, because we're going to have a much better network in place, and already we're starting to see some positive results emerging from that.
The Honourable Jim Anderton.
Speaker, does the Minister acknowledge that many older people cannot afford dental health care? And if so, does he believe that the mobile dental clinics presently being rolled out throughout the country could be used to treat the elderly?
The Honourable Peter Dunn.
Mr. Speaker, we've traversed the territory from preschool now to the elderly. But can I say that in principle I agree with the proposition the member advances, and that one of the things we have been talking to DHBs about is precisely how not only the mobile units but also the new community oral health facilities can be used more effectively, not just for a particular segment of the year, as has been the case previously.
Question number 5, Aaron Gilmore.
Thank you, Mr. Speaker. My question